Good afternoon, everyone. Thank you for joining us today. This webinar series was made possible in part through the generosity of Amgen, and we thank them for their support. My name is Mike Spigler, and I'm the Vice President of Patient Services and Kidney Disease Education here at the American Kidney Fund. Before we begin, I'd like to direct your attention to the control panel that you should see on your screens. All participants are on mute, so we won't hear you, but we welcome your questions. If you have a question, please type it into the section of your control panel titled Questions. We'll see your questions and we'll do our very best to answer them, either by replying to you in the questions box or out loud during the last several minutes of the presentation. This webinar is being recorded and will be made available for viewing on our website, kidneyfund.org/webinars. And it'll be up there within the next 1 to 2 weeks. For those of you in attendance who are health professionals, we're very glad that you've joined us today and hope you'll recommend this webinar to the patients you work with. However, as a friendly reminder, this webinar is not accredited for continuing education credits, and you will not receive a certificate upon completion. If you believe that your accrediting body may offer you credits for attending this webinar, we'll be happy to send you a certificate of attendance after today's session. Simply email us at education@kidneyfund.org. Today's webinar is the first of its kind here at the American Kidney Fund. Instead of having our speaker lead the discussion, we'll be interviewing our guest, Eric Sebastian Dolby Sr., about his personal experience with kidney disease and advocating for himself in the healthcare setting. Eric was a registered nurse for 17 years, and his greatest passion has always been to help other people. But his life came to an abrupt halt when he was diagnosed with kidney failure that had been caused by high blood pressure. At one point during the time Eric was on dialysis, he became homeless. And with the help of the American Kidney Fund, he was able to get back on his feet and return to his life's passion of giving back and helping others. Eric began to advocate for dialysis patients on the state and federal levels and locally. Eric feeds the homeless and volunteers at a local shelter. Eric currently serves on numerous boards to help other dialysis patients. And we're very glad to say on August 29, 2016, he received a kidney transplant, which he says has given him his full life back. One of Mr. Dolby's mottos is never forget where you came from. Eric has been a longtime partner and friend of the American Kidney Fund, and we're honored to have him do this webinar with us today. Welcome, Eric.
Thank you. I greatly appreciate this opportunity.
So let's start by having you walk us through your journey with kidney disease. Start with your experience, when it began, and go up to where you are today.
Well, basically, when I began to think back, when I was asked to do the webinar, I thought back to when actually my kidney disease started. It started much more before I became on dialysis. It started actually in my younger years when I was suffering with hypertension, which is one of the leading causes of kidney failure. So for years I had hypertension. I began to get malignant hypertension, which is uncontrolled hypertension, even with medication. So as I worked as a healthcare professional, as a registered nurse for such a long time, even knowing the outcomes of not taking your medication and being a non-compliant patient, I found myself abruptly on dialysis in the year 2005 as I was doing a travel assignment for an organization, traveling from North Carolina to Texas. And while doing this travel assignment, I began to feel some chest pain. And I went to the emergency room in Opelika, Alabama, and I found myself, when I woke up 3 days later, I was on dialysis. Dialysis has caused me to lose everything I had financially. I began to be despondent. I became depressed and oppressed because I wasn't able to do the things that I really love to do, which was help other people. So after losing everything, I became homeless. I lived at a truck stop in Houston, Texas for quite some time. My pride kept me from talking to my family about my issues and my situation. So subsequently, I decided one day I went to my social worker to let her know what was going on, and my social worker pointed me in the direction of the American Kidney Fund. I reached out to the American Kidney Fund, and they helped me with resources to help me get back on my feet. So I continued on dialysis for several years with other complications going on, persistent, and learning more about the American Kidney Fund. I began to give back in the area of advocacy. And I began to advocate for people I started off advocating in the dialysis facility, and I became a advocate partner with the American Kidney Fund, and they began to train me and show me how to advocate, on a state level and then a federal level, and they began to bring me into fly-ins to advocate in Washington, D.C. During this time, I'm still on dialysis, but due to new regulations, I was able to get a transplant August of 2016.
That's great. And you talked about you were diagnosed with high blood pressure, kind of uncontrolled. At any point, did any of the doctors say to you, this kidney disease might be something to look out for?
No, basically their whole thing at that time, they were just pretty much concerned with the hypertension. Yeah. Even though they knew my family history of hypertension, they never, dialysis, they never really went into, telling me, hey, look, you're going to wind up on dialysis real soon. They were just in the process of trying to control my hypertension.
Got it. So when do you think the switch happened, when you started to take more of an active role in your own healthcare?
When I began to take a more active role in my healthcare is when I found out about the actual American Kidney Fund's advocacy program. I reached out and I looked at their webpage, and they were, sharing what you could do as an advocate, things of that nature. And so I said to myself at that point, hey, look, this is something that I can do because I like to, speak up for people and help people out. So I started off basically at my dialysis unit at that time. I began to see things that were, not in place and not, being done in a proper fashion. So I began to speak out. And at that point, I began to say, I'm an advocate.
That's really great. And I know for a fact you've helped so many patients that come to us that you've counseled over the years too. So we really appreciate what you've done in that area. Well, was there ever a time you felt uncomfortable taking an active role in your healthcare or speaking up about your needs? And if so, how did you overcome that fear?
Well, initially there were a lot of times where I felt uncomfortable because I felt there were going to be some retaliation towards me. And in some instances there were, I began to be treated differently. I began to be shunned upon because I was the dialysis patient that would speak out about his care. Basically, I had to get over my fear of being dealt with as far as the staff, because I had to realize that this is my life and I had to take control of it on every aspect, not just with my medication, not just with my diet, but also taking control and understanding the modality of dialysis I was dealing with.
Right, great. So obviously your experience as a patient's been unique because of your background as a nurse. Do you think that helped you in some ways and held you back in other ways? And what would you recommend to folks who don't have that same kind of healthcare background?
Okay, well, it helped me in a lot of ways because I understood the medication, I understood the lingo of the doctors, and the one way I would say that it held me back was because my knowledge of a lot of things made me more aware of things. And so when I would begin to ask certain questions, doctors and some of the nurses would shun away from me, or if they knew I had a question, they would try to avoid me. The one thing I could recommend to any patient that does not have a healthcare background or understand dialysis or the modalities of dialysis that they're dealing with is to educate themselves by doing a lot of research. When you know that you're headed in the direction of dialysis, do some research in relationship to dialysis treatment, your options for dialysis, some of the regulations that go into dialysis facilities, because there's a lot of little regulations that could hinder a patient from wanting to do their treatment.
What are some resources for people to kind of do that research, especially if they may not have access to the internet or some of the ways? What would you recommend for them to try to do that initial research?
Well, initially, I would say talk to your initial doctor, and then they refer you to a specialist which is a nephrologist, a kidney doctor, I would say ask them as many questions as you can. Write down questions before your appointments. Understand why you're going on dialysis. Understand the different medications. Ask them if there are different options for dialysis. What can you do to slow down the progress of dialysis? All these different outlets. Also, there are resources online. The American Kidney Fund has an educational department that you can go online and look at different resources and options. There are a number of other organizations that have educational resources that are available online. Just Google dialysis. And if you don't have the option to have access to the internet or a computer, or if you're some of the older generation, they don't do the computer, it's simply just ask questions of people you know that may have had experience with dialysis or hypertension and diabetes, anything that led to them going on dialysis.
Great, thank you so much. Can you tell us about a specific time when you advocated for yourself or other patients in the dialysis setting?
I'll give you one specific time when I was advocating for a patient. There was a friend of mine, he was just having some issues. He was real cold. And so I said to him, I said, well, why don't you ask him to turn up the temperature on your machine? And so they did, and he continued to say he was cold. And so he wanted to come off the machine and stop his treatment. So I explained to him, the reason for not doing that, and he understood that, but he wanted to get off the machine because it was so cold. So I asked the nurse, I said, what is the temperature in the facility? And she went over to the thermostat, and she said, oh, it's 68. And I explained to her that the regulation says it needs to be at 62, and this patient here wants to get off the machine because they're cold and they can't take it. They have 2 hours left, and I explained to her the ramifications of if he gets off the machine early, and all the issues that would come from that. And she argued me down that she couldn't change the temperature, so I initially asked for the administrator. Actually, I asked for the charge nurse. The charge nurse came over. She said she couldn't change the temperature, so I asked for the facility administrator. She came over. She did change the temperature, and she did explain to the staff that we understand as patients that they're cold. They're hot because they're running around with the outfit on and the gown and everything, and they're hot. But at the same time, that we're the patients sitting there with our blood being cleansed and everything. So I think it went a little further than them understanding the reasoning why I did what I did.
And what was that patient's reaction to that? I mean, was he?
Oh, that patient was so elated that another patient would speak out for them. Because at that time, I was relatively new at this particular clinic. And from that point on, that patient began talking to other patients. They began to bring me their issues in the lobby. And so I became known as the patient to go to for everything that you needed, or understand what was going on, or speak up for you if you didn't want to speak up for yourself. Because at that point, I had gotten so bold, I really just didn't, I really didn't feel any fear in relationship to bringing the issues to the administrator or to the regional directors.
So some patients find it difficult to speak up and express their needs to doctors or other healthcare professionals, and that goes beyond dialysis. And I can think of family members that do the same thing, even my own personal life. What advice would you give to them to kind of level the playing field, as you said, a little bit with healthcare professionals?
Well, the one thing I would say is to try to establish a successful relationship with your care provider. If you feel that you can't develop a relationship because you're the patient or the client per se, then get a family member involved to speak up for you as a care partner. Maybe in the dialysis setting, for example, maybe there's another patient who has been on dialysis for a longer time, and you see that they have a better relationship with the staff. Maybe you would want to bring, talk to them and say, could you, talk to them on my behalf? Those are some of the other options that I would say. But one of the biggest things I could say is try to establish a relationship with your care team. That goes with your technicians, your dialysis nurse, the doctors, the dietitian, and the social worker, especially the social worker.
And what role do you see care partners as having in that role too, right? Because there may be many patients that have, cognitive issues going on, there could be language barriers. What can a care partner do to kind of help bridge that gap too?
Well, I think a care partner, based on the need of the actual patient, a care partner brings into what we call a buffer. They're the buffer zone to try to help the patient, balance the patient and the staff, because either party could, misunderstand the other individual.
Mm-hmm.
So I think that when you have a care partner who looks at things from a neutral standpoint, it makes it a lot easier for the patient to get what they need and for the facility to get the option to resolve the issue without any further problems.
Great. So it's something we hear all the time, and we know that dialysis center staff are stretched thinly. How can you make the most of that little bit of time that you get with each one of them?
Well, one of the things that I can say that you can do is, again, develop the relationship, talk with them, sometimes give them an understanding of who you are and what your experience with is, what little experience you may have, or what excessive experience you may have with dialysis. And I think that if they understand where you stand and you understand what they're dealing with, as well, because sometimes I think patients, understand that, that the staff is stretched thin. So I think that if everybody understands each other's role, there again, that's a part of the education when a dialysis patient starts dialysis. Explain to them the role of a dialysis technician, explain to them the time frame that they have to spend with you and all the things, in between.
Great. So kidney patients are unique, right? Because they have to often coordinate their health care with several different doctors. A nephrologist, endocrinologist, primary care doc. Was this ever a challenge for you, and how did you overcome it?
Yes, this was a major challenge for me because I had a lot of things going on. I had an endocrinologist, I had a nephrologist, I had my primary care doctor, I had an oncologist, I had a neurologist. I think I had every ologist there was. The only thing I didn't have was a pathologist to help me with my speech. But what I think is that, you have to be very frugal in your time management. You have to be able to schedule your appointments always around your dialysis. You have to always schedule your appointments around certain situations and certain things that you're dealing with at that time.
Great. In talking with all of those, if you could give advice to a nephrologist or a dialysis nurse, or really any physician or healthcare professional about making patients more comfortable, what would you recommend for them?
Well, I would recommend, again, them spending more time with the patients initially, explaining to them what the what their role is as far as the care team, and explain to them, initially ask them a lot of questions and get from them what do they expect, out of them and how they can develop a relationship with each other.
Great. Yeah, I met a patient once. He was a dialysis patient, and he said he had high blood pressure uncontrolled for years, and the doctor said, well, you might have a stroke or this, that, and the other thing. And the guy thought, well, if that's the way I'm going to go, that's the way I'm going to go. But he said if the doctor had gotten to know him better, understood that this guy was an executive at a Silicon Valley firm, and he said if someone had said to me, your salary is going to go from $250,000 a year to zero, I would have taken my blood pressure medicine. So
right.
it's so important to get that, build that rapport with the patient, kind of understand what their life goals are.
Right.
Really. So again, congratulations on getting the transplant in August of last year. What was your experience with getting listed for a transplant and then eventually receiving a kidney transplant?
Well, my experience with getting a transplant, it took quite some time because in order to get a transplant, there's so many different things that you have to have in place. One, you have to have a care partner. Two, you have to have your financial resources in place. Three, you have to be physically sound. Now that kind of sounds ironic because you're a dialysis patient with a chronic disease, but they want you to be, physically sound. So you have to have all types of screening processes done And once all those things meet the criteria, then once you meet the criteria, then they take you to a committee, which then determines whether or not you are actually feasible for their team to do the transplant. And that's totally their option, you know. So my experience when it took me 4 years to actually get listed. But prior to that, before I decided to even get listed, I was so angry and frustrated with the lack of understanding about actual transplant and what my options were and how much greater I would feel, because the whole time that you spend in dialysis, they may mention to you initially about getting a transplant, but there's never a transplant patient that comes in and lets you know how great it is or how good your options would be living back, you know, without being on dialysis. So at that point, you know, I didn't really have no which way to go. So when I finally decided to get my transplant in 2012, I felt like all my options were out the window, because I began to start meeting all these other challenges. I was overweight, and then they found out I had cancer. Then I had issues with my calcium levels. It's just so many different things came about. But because I stayed steadfast and I stayed focused on making sure that's what I really wanted to do, and I didn't give up, what I finally decided to do was, there were hospitals that turned me down because of this or because of that. So I finally decided to seek out other options outside of my state, and that's when I finally got my transplant.
So you said you were on dialysis for 13 years, and there's no one really coming in the center to talk about the benefits of a transplant. What was the kind of light bulb moment for you that said, you know what, I'm going to do this. I'm going to find another hospital outside of the state to try to do this. What was that moment for you?
That moment was my wife. We got married in 2011, and my wife said to me, she says, you're going to get a transplant. And me personally, I didn't want one. I thought everything was over. I had given up on everything. I had given up on my credit. I didn't care about working. I didn't care about anything. My wife at that time, she said to me, she said, listen, how much better would it be for us if you're not sick all the time? We could have a normal marriage. We could have a normal relationship. We could do things together, and you don't have to juggle everything around your dialysis and being sick all the time and spending our anniversaries and your birthdays and Thanksgiving and Christmas and all these different holidays in the hospital. And so I thought about it. And I said, you know what? You're right. Then my kids talked to me about getting a transplant. And then my granddaughter said to me about getting a transplant. So I just made it something that I really had to do. But the light bulb was, when you have someone that comes into your life who cares and shows you that this is what you really need to do to live a normal life. Because actually, I thought living on dialysis was normal. It become normal to me.
Right.
You know, going to treatment, it was like going to a part-time job.
Right.
You know, 3 days a week, 6 hours a day. To me, it was a part-time job. So I did that, and I came home, and I slept like I would do if I was on a part-time job. So it really had become normal. So now, you know, I feel a lot better. I feel like a regular individual.
Right. Mm-hmm. Right before we went live, you were talking about, so you received a deceased donor transplant kidney. We're talking a little bit about kind of that donor and how important it is for folks to sign up to be an organ and tissue donor and to give that gift of life.
Right. Well, the donor that gave to me, she was it was a female. She was a 55-year-old Caucasian woman. And so I explain to people sometimes, if you see me crying, it's just a little bit of extra estrogen I get through my kidney. And so that you know, I feel comfortable because you know, now on my applications I put down I'm multiracial, you know, because I got a 55-year-old kidney from a Caucasian woman. But I think that that people that they have family members that when they're in accidents or different things that occur, I think that giving back, if you can't give back in any other way, you can give back through your transplant. You can give back through different, donating different parts of your family members, organs or your own organs. Every state has the option to put on your driver's license that you can be an organ donor. If something happens to you, you've already made that decision. You don't have to wait for a family member to make that decision. You can make it when you sign up for your driver's license, or you can make it known when you go in the hospital. If something happens to me, I want to be an organ donor.
Right. And that selfless act, how many transplants you said came out of that one donor?
Out of that one donor, there was 14 different people who had the option to be able to live again.
That's really, really fabulous. So, Eric, now that you've had a transplant, are there new or different ways that you've needed to advocate for yourself?
Well, I've had to advocate, actually, as far as my transplant is concerned, I've had to advocate on different levels because my transplant team is really good, but there are some times I've had to advocate for myself when it came to my medication or when it came to different areas that I've had to access in relationship to, like, for example, some of my medication. I had to advocate on behalf of getting some of my medication. I'm seeking out other options to be able to pay for the medications and things of that nature.
Great. Well, we've gotten plenty of questions already from the audience. For those listening, if you haven't already put in your questions, please make sure to do that to the questions box. But before we move on to that, Eric, any final recommendations that you have for folks that are listening today?
Well, what I would say is, number one, first advocate for yourself. Number two, advocate for your fellow dialysis patients. Number three, get in contact with organizations such as the American Kidney Fund and other organizations that advocate on a state and local level and a federal level, because these organizations can show you and teach you the things that are going on in Congress, not what you see on TV, but the realization of understanding advocacy, healthcare issues, and it will broaden your understanding of not just for dialysis patients, but for healthcare individuals all together.
That's really, really awesome advice. And one other thing that we talked about too, right before we went on too, is I understand that you're a patient rep for the ESRD network, the Stage Renal Disease Network.
Mm-hmm.
Can you talk a little bit, what exactly does that entail, and how can patients use their patient reps to their advantage?
Okay, so a patient representative is a patient who has made a decision to advocate for other patients despite their issues. So what we find is that these patients are an outlet for patients who are currently on dialysis. I became a patient rep with the End-Stage Renal Network number 6, which covers North Carolina, South Carolina, and Virginia. North Carolina, South Carolina, and Georgia. So this network gives you different outlooks and options as far as your grievancy process when it comes to advocating, because during your advocating process, everything's not going to go smooth. So sometimes you're going to have to kick it up to the next level, even beyond the facility, even beyond the state level. But these networks also work in conjunction with Medicare and with the facilities, so they can get a lot of things done for you as well.
Great. So now we've got plenty of questions. Let me jump into the first one here. Someone asked, what are some things, if anything, that you would do differently if you could with regard to your experience as a patient?
Follow my recommended treatment process. There were a lot of times, because of my depression, because of my anger, because of my frustration, I did not necessarily follow every particular area of the process that they put before me. So if I could do things different, which I think would have made my whole dialysis experience a lot easier, is I would have followed protocol from the beginning.
Great, good advice. And someone asked a question regarding the patient you talked about with the cold temperatures in the dialysis center. You talked a little bit about how the particular patient responded. They're very elated that someone reached out to them. What was the outcome of your advocacy in the larger setting of the center? How did the staff respond to that?
Well, some of the staff, they understand what the role of a patient rep is, but they also understand that when you're there, they have to pretty much be on their P's and Q's. So a lot of times the staff, they welcome you, but then, sometimes I think you can kind of be like a little thorn in their side. So it varies, just depending on who the staff is. Some staff appreciate it, and some staff really don't appreciate it because they really don't want to have to, answer to you or answer to the particular situation.
Great. And someone asked a question about just getting in contact with the patient representative from the ESRD network. How does somebody go about finding out who that person is?
Pretty much all you have to do is ask your social worker. Your social worker knows who the patient reps are in the particular facility. And if you don't have a patient rep, you can get in contact with your network, and your network can either let you know who is a patient rep in your facility, and if there's not one, you can become one.
Great. So we talked about something you would do differently. A question is, are there any experiences that stick out in your mind as being particularly positive when it comes to articulating your own needs in the healthcare setting?
I believe that every opportunity I had to speak up for myself was a positive, not only for me, but also for the staff, because I think that it developed a relationship with us that they understood that I was going to stand up for my needs, and they understood that they were going to be held accountable for my needs because my life was in their hands. So I think it's always been a positive outcome, sometimes frustrating, but at the same time, it was positive.
Great. And there's some more coming in. I've got one more here right now. If someone's not used to speaking up for themselves in a healthcare setting, I mean, what do you recommend for them? What are some tips again for those kinds of folks?
Well, there again, if you're not used to speaking up for yourself, I would ask for a quiet meeting with with possibly, first of all, your social worker. And if you meet up with your social worker and you feel like things have not gotten resolved, then you can ask for a private meeting with the administrator and, understand the chain of command. Once you've gotten to a point where you still don't feel like you've gotten the situation resolved, I think basically what you can do at that point in time is then you can begin to reach out to your network, and your network will give you other resources to help you file grievances or any options that you may need at that present time.
Well, you answered the next question already. A lot of patients, so someone's saying, and you mentioned this too, fear of retaliation from the staff when speaking up. Has that ever happened to you? And if so, or did you feel like there was a kind of even a threat of that? And if so, how did you get around that?
Actually, I did. There are two times where I can justifiably say that I felt the retaliation because the staff knows what they've done to a particular patient. So when that patient reports them, they automatically know that it came from the patient or someone in that area. So, staff begins to they don't want to talk to you anymore. They want to mistreat you, or they want to act like you don't exist, or they make you wait a little longer to get on the machine, or wait a little longer to take you off the machine, things of that nature. At that point again, I still stand up for myself. And if what I reported to them, if what I reported to the social worker has now put me into a position of fear for my care, then I then report it to the next level in the chain of command until something is done. And there have been times where there have been staff that have been discharged or no longer have been allowed to work on those particular days that I was there, or whatever patients that was being reported the allegations were.
Thank you. So something we hear a lot about, and it's come up in some surveys we've done of our patients that we assist, is depression. What can someone do if they struggle with depression and as a result struggle with their treatment regimen as well? Was your healthcare team helpful in giving you resources to manage depression or some of the other patients you may have worked with, depression and or anger? Which is a whole spectrum of emotions folks are dealing with.
Well, the biggest issue that patients are dealing with is depression. On one of our affinity groups, we talk about the mental health aspects of depression. And I can say from personal experience, I've dealt with every level of depression. Situational depression, I've dealt with manic depressiveness, I've dealt with every area of depression. I really don't believe, in my personal opinion, that the area of depression is addressed in the dialysis facilities on a rigorous level. I really didn't start getting help until I went to the hospital. And I began to realize that my depression was the cause of some of my hospital stays. It wasn't actually the physical aspect of me needing to be there, but because of the depression, I was non-compliant, which ultimately put me in the hospital. Depression can put you in a position and in a state of mind where you don't even want to tell anyone that you're depressed, when you want to make everybody think everything else is going well. But secretly in your mind, you know that you're going through something. So I reached out when I was in the hospital, and I began to cry and tell my doctors and different healthcare professionals that I was working with what was happening with me. And they decided to make the recommendation that I would see a mental health worker while I was in the hospital. And ultimately, I seen the mental health worker, the psychiatrist came over. They had me on some psychotropic medications for a while. Then they weaned me off the psychotropic medications. They gave me different options to deal with depression. Being able to join different organizations, church groups, and within these different organizations, everybody had different options to help you deal with, your particular state of mind at the time.
I really appreciate that vulnerability and openness with that, Eric. Thank you very much for sharing that. Again, we talked about how thankful you are to have gotten that gift of life from a donor. What about what can communities do to make themselves aware of the importance of becoming organ donors, and that you can be a living donor? Mm-hmm. You can be a living kidney donor. Mm-hmm.
Well, I think what needs to happen, and my personal opinion is educating the community on understanding the options and how they can give back. A lot of times people don't give back as far as live donors because they're concerned with I'm going to have one kidney, what are going to be my options? There again, if they educate themselves and they understand that they can live with the one kidney, and then not only living with the one kidney, what they can find themselves is that they would have, if something happens to their particular kidney, they would have the option of getting a kidney transplant more expeditiously than another person was because they gave the life to someone else. But also the main thing is to educate yourself, to know what you can do and what you can't do as far as giving. Everybody's not able to give as a living donor because they have other things going on. Even if they're a deceased donor, they have a lot of things that they can't do because they had other things going on in their life prior to them deciding to want to give.
I think you open us about the mental health issue. Open up another question here. Someone said in relation to mental health, did you find that advocating for others actually helped you yourself cope?
Absolutely. That's the way I get through my day-to-day process. I could be having the worst day, and not just advocating for a healthcare patient. I can advocate for, if you call me and say you have a problem with, your housing or whatever the case may be, if I can go and speak on your behalf, it gives me such an elating feeling. It releases the endorphins in my brain, which gives me so much power. I feel like I'm just like, I feel like I Superman at that present time, because if I got your issue resolved, my issues don't even seem great at all. So when you begin to advocate for other people, you begin to engage, you actually realize that you're actually helping yourself. Right? You're actually helping yourself on a mental level, on an advocacy level, and it just helps you, and it just motivates you to want to help more people. That's how I really got engaged in it.
That's great. Mm-hmm. So I heard this from another advocate that talked to our staff about a week or so ago about having survivor's guilt after having a transplant, right? She felt bad for the folks that were still in the dialysis chair and doing that. Is there anything that you would tell a patient who is facing that situation, and what can they do to continue to help those patients if they're feeling that?
See, I don't feel survivor's guilt. You know why? Because I go back and I visit my center. I talked to other dialysis patients. I did home dialysis for 2 years. That's when I felt guilty, because I'm saying I'm at home in my bed, watching my TV, eating my food, and I'm on the machine. But when I went back to the facility, it made me appreciate more and more of what I do. So what I would say is this: the way you get over survivor's guilt is don't forget where you come from. Reach back and help the other person get to where you're at. And the more you do that, the less guilty you feel about leaving your people behind. You know, the Marines have a thing, no man left behind. So if every transplant patient would help a dialysis patient, then we would have more transplanted patients and less dialysis patients.
Right. So you've been through, so you've done home dialysis, you've done in-center dialysis, you've gotten a transplant. What do you recommend for patients that maybe don't understand all the different modalities that are out there and options? You know, how can they ask the right questions to understand what's best for them and how they can get access to some of those other treatments?
Well, the first thing you have to express to your nephrologist and your primary care physician is, one, that you're not going to give up on life. That's the first part. You want to continue on with what you're doing. And then you ask them, if I want to continue working, what do you think is the best option for me? And then they'll go into whether you can do home dialysis, you can do peritoneal dialysis, or they think that hemodialysis in center is better for you. Initially, it just depends on what you express to your care team and what you express to them as far as your goals. One of the recommendations I can make to every dialysis patient is to go to your care plan meetings. This is where you have an opportunity to sit down in a round table type setting and talk to every person that's on your care team and express to them exactly what your goal is for the next 3 months, for the next 6 months, for the next year. And then they will tell you, or they will give you different options to say, well, you know what, maybe you need to look at doing it this way, or maybe you need to look at doing it that way. I think that a lot of patients take for granted that they have that opportunity to be a part of their care plan team. You know, they just say, okay, they meet with their doctor, they talk to their nurse. But there's a care plan meeting that every patient should be involved in or should be invited to, which makes them aware of everything that the team has set the goals for them, and whatever goals they set for themselves, they let the team know and become a cohesiveness to see what the full outcome can be. And I know is that something that says so you've worked at dialyzed at a couple of different centers, right? I mean, without naming exactly the companies, I mean, have you had better experiences at some clinics than others, and have they all done these care plan meetings? And if not, how did you go about changing those centers, or what kind of spurred you to change centers? Well, here's the thing. According to the federal regulations and Medicare, they have to have these care plan meetings because these care plan meetings dictate to Medicare and all the authoritative people exactly, you know, what they're doing for dialysis patients and how well they're going to work with making that particular modality work for you. So basically, what happens is that your social worker is the key person that you need to engage with, because they're going to let you know when the care plan meetings are. They come around and do questionnaires with you right before the care plan meeting. You know, it's like maybe a couple of weeks before, so they can put together a plan of care for you. And once they do that, then they come back and they talk to you and try to get you to understand what their goal is for you, and they try to understand what your goal is for yourself. Great. We have time for about 3 more questions, so let me do this one. Someone that watched the Facebook Live clip, which if you're not a member of our Facebook community, please make sure you join, because we'll be doing more of these kind of preview things for our webinars moving forward. But you mentioned during the Facebook Live clip that asking for a second opinion from a doctor is a way of advocating for yourself. Why is this so important, and do you have an example of when you've asked for a second opinion and had a positive outcome? Okay, it's very, very important to always ask for a second opinion, because sometimes as human beings, there's things that are questionable, and everything is based on that one particular person's view of something. Well, if you bring in that third party and they look at it from a different aspect, their view may give you a different outcome or a more broader perspective of what your options are. In my particular case, when it came down to a particular surgery I was having, I asked for a second opinion, and another doctor came in and looked and said, hey, look, I don't think you really need to have this surgery right at this particular time, so we're going to hold off on it. And that kind of made me feel a little bit better than just having the surgery right away, because one particular doctor felt like it was going to be beneficial to me. And actually, waiting to have that particular surgery actually panned out to be a wonderful thing, because later on I found out that the device they were using was defective.
Wow. So what are some questions that every patient should be asking their doctors on a regular basis?
Well, first of all, every patient needs to understand what their creatinine level is, what their phosphorus level is, and if they're on any other type of medications, how their medications interact with their dialysis. How does dialysis take those particular medications out of their body? One of the things that dialysis patients need to ask their doctors all the time is their clearance level. Am I being cleaned enough? You know, a lot of dialysis patients, one of the things is, well, how can I reduce my time on dialysis? Well, one of the things you need to ask your doctor is, if I want to reduce my time, what do I need to do on outside of dialysis to increase a better clearance? Whether it be to change my dietary habits, increase my physical activity, or whether it be to whatever they recommend at that particular time is some of the things that you need to be aware of. The biggest things that you ask your doctor on a consistent level is, you know, how can I make myself more healthier by living on dialysis? And also, how can I make myself more readily available to get a transplant so that I can live a normal life again?
Great. So do one more question, and this is a softball for you, but what are your plans for the future? What are your next plans for advocating on others' behalf?
Well, right now, I have no other plans but to actually just advocate for people, any patients that need my help in my local area, or anybody that contacts me that knows me or knows someone that knows me on a larger scale. Whatever I need to do to advocate for you, or to point you in the right direction, or to give you options that you may need, or help you with resources, that's my goal.
That's awesome. We really appreciate it. We have one more question came in that I think is really good I want to ask, because it's definitely something that we see all the time is, you know, you talked about all the different appointments you had to have, all the different doctors, but there's all these different medications you're taking, there's lab results. How do you keep track of all that health information, especially when you're on dialysis, to you know, keep yourself going in the right direction?
Okay, one of the things I do is I keep a record of everything. So anytime that I get my lab work, I keep a copy of it. I have a file folder of every single lab result. And I have one for my labs, I have one for my medications. And anytime there's a medication change, I highlight it on my forms. There again, even with your time management, you have to be frugal in your organizational skills, because believe me, at some point, I was on about 22 medications. I had to keep all those lists of medications at all times, knowing those medications. But fortunately, if you remain in the same areas, like when I say live, when you live in the same areas for an extended period of time, a lot of hospitals are on the same medical program now. So what happens is, if you go into one particular hospital, your doctor can log into and pull up your medications. So it's not as expensive now as it was in the past. So one of the things that I would say is, in order to keep it, you need to kind of adjust everything that you need to do to make sure that you have a list of everything that you got going on, and as far as your lab work and everything, you really don't have to understand all of it. Just know the stuff that's too high and too low. The stuff that's normal, you don't really worry about. If it's too high, you ask your doctors, what do I need to do to bring this up? If there is anything you can, and stuff that's too high, what do I need to do to get this within normal limits?
So we have several people that have asked for your contact info. I don't know if you're willing to give that, or if not, you want to come through us and we can help quarterback that for you, but it's up to you if you have an email you're comfortable putting out.
I'll put out my email address. It's Dolby, DOLBY, .advocate@gmail.com. If anyone needs to reach me, they can reach me through that, and I'll kindly ask any questions or reach out to you any way possible that I can help you. Or you can go through the American Kidney Fund and reach out to me, and American Kidney Fund will redirect any information that they need to get to me, and we'll work together as a cohesive team to try to help you get your situation resolved.
Absolutely, and we're happy to do that. And again, our email address for anyone that wants to do it that way is education@kidneyfund.org, and that might be even a better way because we might be able to send them to other resources.
Right, exactly.
In addition to you, Eric. Well, thank you very much. This was really, really great. I really especially appreciate the extra time for all the questions we had come in. I think that's a sign of a really good webinar information that you gave.
Thank you very much for having me.
Of course. So thanks again, Eric. And as a reminder, if you are a healthcare professional, please share this webinar with your patients and their families. And if you would like to receive a certificate of attendance, please email us at education@kidneyfund.org. Our next webinar will be held on Wednesday, April 26th from 1 to 2 p.m. Eastern. Dr. Susan Wong will join us to discuss making the choice not to pursue dialysis or kidney transplant. Dr. Wong is a nephrologist at the VA Puget Sound Healthcare System in Seattle and an acting instructor in the Division of Nephrology at the University of Washington. Some people decide that dialysis or kidney transplant is not the right choice for them, and in this case, conservative care is an option. Conservative care will not treat kidney failure, but will help to manage the symptoms of kidney failure and enable a patient to live as comfortably as possible until his or her body can no longer function. Dr. Wong will discuss the conservative care options for end-stage kidney disease and considerations for patients or their family members when making the decision to choose conservative care. Registration is now open. Visit kidneyfund.org/webinars for more information and to register. And when the webinar closes, please do not close your browser window, as you may see a pop-up saying that the webinar has ended. Please close that pop-up and proceed to the webinar evaluation survey. Your honest feedback will help us to make our webinar program the best it can be. Again, this is Mike Spiegel with American Kidney Fund. Thank you, Eric, for being here today.
Thank you for having me.
We'll see you next month.